Welcome to the second episode of our digestive health series on health matters on the medicine box. After discussing healthy eating in our last episode, we now focus on the linkage of food and lifestyle to the gut and digestive health. The gut is the entire digestive tract from entry to exit for anything you consume. It comprises of the mouth, esophagus, stomach, small intestine, large intestine or colon, rectum, etc. The gut is known as the second brain because of its extensive nervous system and independent functioning, probably prompting the phrase, go with your gut. With trillions of good and bad bacteria, the gut over the years has been linked to various health conditions, from everyday digestive issues such as bloating, acidity, constipation, to even heart disease and diabetes. The famous brain-gut axis, which connects gut function to the brain, has been linked to various conditions, from irritable bowel syndrome to neurological conditions like Parkinson's, depression and autism. In India, the prevalence of digestive diseases is increasing, with lifestyle factors playing a significant role alongside genetics. For instance, 7.6 to 30% of the population suffers from acid reflux, linked to habits like smoking and dietary choices, while constipation affects 22%. Esophageal cancer associated with betel nut and tobacco use is the fourth most common cancer. Stomach cancer, often linked to spicy food consumption, ranks fifth. Colon cancer, though historically less common in India, is on the rise amongst the youth, possibly due to dietary changes such as increased meat consumption. Understanding the importance of gut health and its relationship to food and lifestyle is critical for good health. Today, we are honoured to welcome Padma Shri awardee Dr. Amit Maydeo, a leading expert in digestive diseases with over 40 years of experience. Dr. Maydeo will help us navigate the complexities of the digestive system and answer questions.
Most intriguing is the gut. It's in fact called as the Pandora's box or the magician's box. All these 14 organs have to function in harmony with each other. And in addition to that, the gut functions independently from the brain. In our practice, very common problems which we see are: number one is dyspepsia or acidity. Second common problem which we see is gas bloat. A properly balanced diet will give sufficient amount of probiotics, so you don't need to take probiotic supplements.
Welcome to the show, Doctor.
Thank you.
Well, let's start with what is the gut and what is the importance of it?
Well, as you rightly said, gut starts with the mouth, ends at the anus, and it's one of the most interesting organ systems of the human body. As all of us know, human body has a lot of organ systems starting from neurological, orthopedic, genitourinary, and cardiovascular, and various other organ systems. But the most interesting, most intriguing is the gut. It's in fact called as the Pandora's box or the magician's box. You know, the reason is that because the gut is not just revolving around one organ. There are 14 different organs which are there in our gut, which are playing an important role for digestion. And each 14 of these organs has got their own role. In fact, I sort of call it is almost like an orchestra, which is being controlled by the mind, controlled by the brain, and also controlled by the nervous system of the gut itself. It's autoimmune. I mean, it's on its own. It runs on its own. In addition to that, for example, if one musician doesn't play the instrument properly, then what comes out of the orchestra is not music, not a melody, but it's just noise. So all these 14 organs have to function in harmony with each other. And in addition to that, the gut functions independently from the brain, because many of you may not know, but the gut contains 30 trillion bacteria, 30 trillion microorganisms. So it's like a different world altogether inside the gut. And there is a different nervous system. There are almost 100 million enteroendocrine cells which are lining the gut. And if you see the bacteria, there are more than 7,000 different species of bacteria. So what happens is these are all good bacteria, and they are lining in the gut, they are remaining in the gut, and they create a completely different environment. So that's the reason why the gut is very important, and it's such an important organ system of the body.
But what is the linkage of the gut to overall health?
Oh, it's very very important, because you know what, because there are two main things because of which the human body functions. One is breath, that is the oxygen that we consume, and the second is the food that we take. Now, breath is happening on its own because that's automatically you are breathing, but the food that we consume, that is dependent entirely on the person. The type of food, the quantity of food, the constituents of the food, the timing of the food, everything is very important, because that gives not only the fuel, but that is the medium on which the bacteria are thriving. In fact, many of us have got a misconception that the food that we eat is getting digested by the enzymes which are getting secreted in the body. It is not just the enzymes, it is the bacteria. The bacteria population, the bacterial spectrum what we have, that decides how your food is going to get digested. And the nutrients, the proteins, fats, the carbohydrates that we consume get properly digested and then absorbed, from which the nutrients go through the bloodstream. It gets filtered in the liver, because all the blood from the gut goes through the liver. Then the liver is the filtration plant of the body. And that filtered blood then goes to the lungs to get purified, where the oxygen gets mixed into it, and then that is supplied to the heart, which supplies it to the entire body.
Okay.
So, all the nutrients from the gut are absorbed. So, that is why the gut is important to the overall health. So, if we eat wrong food, then various types of illnesses can occur, affecting all different types of organs of the body.
So, which are the most common digestive diseases that you see amongst Indians?
Oh, so commonly in our practice, very common problems which we see are, number one is dyspepsia or acidity, which is very common. Probably that is related to, again, improper food and the changing lifestyle, because people are not getting time to eat their food properly. They are having too much of mental stress, tension, targets to achieve, because of which the digestion process doesn't happen properly, and they don't get time to eat food, or they gulp their food fast. And so acidity is one common problem, which can also happen because of some ingested bacteria which goes in through the impure food or impure water or uncooked food, and that leads to acidity symptoms. Second common problem which we see is gas bloat, bloating of the tummy. Some people come to me with a lot of burping, incessant burping, especially youngsters, young ladies, young girls, loud burping, they're constant burping, or even housewives for that matter. That is one way. Or of course, people who are working in executive positions, they have a lot of bloating type of problem. That means they all the time have a bloated tummy. They always feel full, they are not very satisfied. This is the second problem, is bloat. The third common problem what we see is constipation. See, constipation does not necessarily mean not being able to pass your motions. Constipation means improper motions, going more number of times, or every time you go but you are having an improper, unsatisfactory feeling that you have cleared your bowel properly. Or as the age increases, then the constipation has a different variety. That means they just don't get the urge, what we call bowel inertia. So constipation is very commonly seen in all different age groups, predominantly seen of course in the older age group, but nowadays we are also seeing in the younger age group. I'm getting young patients nowadays, young girls who sometimes don't even pass a proper motion for one week, 5 days. That is also a possibility. That also type of constipation we see.
So, what has changed in the Indian diet for acidity to increase, bloating to increase, as well as constipation?
If you ask me personally, one of the common reasons for acidity to increase is timing is not being maintained of the food properly. There is a long gap between two meals, and then one meal that they eat after being very hungry, coming home, they eat until they feel completely full, and then they go off to bed very early after eating the food. Number two is they don't get time to chew their food properly. That means they are just gulping the food fast. So one step of digestion is sort of is bypassed, because mouth and chewing the food itself is an important step of digestion. That is grinding of the food, and it gets mixed with saliva, because saliva contains an enzyme called salivary amylase. So that itself starts your digestion process. So that one step is skipped. Then of course impure food, eating food on the roadside, eating stalls, and another very important is processed and refined food, fast food. That also can cause a lot of acidity and other type of symptoms, because that can lead to again improper digestion, inflammation of the stomach lining, and cause symptoms of acidity. So these are the common causes of acidity.
So when does one need to see a doctor when they have such kind of issues? Because a lot of people think that these are household issues, that, you know, if I have some medicine, if I have something at home, it'll probably get resolved. But a long amount of, or a long phase of acidity can also lead to other digestive diseases eventually. So when does one need to actually see a doctor for these common ailments otherwise?
See, I'll tell you what, ki if acidity is not getting solved by very simple home remedies or just adjusting your diet properly, all the time you keep on getting tightness in the tummy after eating your food, or you keep on getting reflux, acidity, heartburn, which is happening very frequently, that is a time where it is always better to consult your doctor, because nowadays we do this procedure called endoscopy, by which we look inside the stomach and we can actually try to diagnose actually what is going wrong there, whether the wall between the food pipe and stomach has become loose like a hiatus hernia that is causing the acid to come up, or whether the lining of the stomach is inflamed. We can diagnose if the person has got H. pylori infection, which is commonly seen, which goes in through impure water or uncooked food. So the point is not that acidity leads to any malignant condition or any condition which is dangerous, but long standing acidity can be one of the manifestations of early cancers. Early cancer in the stomach, early cancer in the food pipe. You know, there was a study conducted in Japan where they found patients of early gastric cancer and early esophageal cancer, and they were just asking them, what were your symptoms? And 80% of these patients said that I had just acidity, which is now increasing since the last 6 months or so, and it kept on increasing in spite of simple remedies, and this was the symptom. So that is what I say, that if any person has got acidity for a long time, if it is not going off by simple remedies, it is definitely worthwhile consulting your doctor, getting yourself checked up, so that you can at least stem it in its bud and don't allow it to progress, or you can pick up an early cancer for that matter.
Okay, well, we'll get to cancers in just a bit, but about constipation in children, that also seems to be an issue nowadays, simply because of the incremental amount of processed food that they're probably exposed to.
You know, that's an interesting question, because, you know, in children, the commonest cause of constipation is habitual constipation, where right from birth, right from the time the child is a toddler or a very small kid, they are not being taught by the parents to pass motions at a particular time of the day on a regular basis. What happens is, usually mothers allow the child to pass motions whenever the child feels like passing. That is one habit which needs to be properly followed, and the child has to be taught right from childhood that one particular time of the day you should make the child sit and make the child pass motion. This is a common cause of constipation in children. Then of course children like fast food, children like to eat outside food, and you know, somehow because the child is not eating anything, then the mother gives the child whatever the child likes to eat, and then somehow that leads to constipation. The vegetable intake, the fiber intake, the fruits intake is not good enough. So I think that the child needs to be taught right from the childhood that these are important things.
Okay, well, when it comes to cancers, and we'll talk about that now, which are the cancers that can affect the digestive system, which are probably the most common, and what are the symptoms one needs to be aware of?
So there are various cancers which can affect the digestive system. Let's start from the esophagus. The food pipe is one cancer which is very common in our country. In fact, that is the commonest GI cancers affecting Indian population. The reason a few years back was, of course, plain simple tobacco or betel nut, betel leaf, lime, which is there in that. That can definitely lead to esophageal cancer, which is called squamous cell carcinoma. However, in the recent trends, we are finding that because of acidity increasing, reflux happening, acid getting exposed to the esophageal lining, now they are developing different type of esophageal cancer, which is called adenocarcinoma, which happens mainly because of acid reflux. So, this is one. Second is stomach cancer. Stomach cancer can happen if again the stomach lining is inflamed for a very long time, and then the stomach lining gets denuded, what we call as atrophic gastritis, and that can lead to stomach cancer.
But why does the stomach lining get inflamed?
It gets inflamed again because of infection, because of bacteria called H. pylori.
Okay.
H. pylori is very common in our country because of impure food, because of uncooked food. And so, if you do find H. pylori in the stomach, it needs to be treated very well with antibiotics or properly. Because H. pylori is known to be a precursor of gastric cancer. It is known as a pre-malignant condition. Stomach, though it is not a very common cancer in our country. Third is colonic cancer. Colonic cancer is commonly seen in the Western population, and in Indian population it is seen in those people who have predominantly non-vegetarian diet, where the fiber content of the food is less. So, these people tend to develop colonic polyps very often, and colonic polyps then turn into cancer, or directly de novo a colonic cancer can form. Now, as far as the symptoms are concerned, esophageal cancer, unfortunately there are no symptoms until it increases and until the patient has difficulty in swallowing. Stomach cancer, yes, if you have tightness of the tummy after eating food, if you start feeling full after eating little bit of food, that means your meal quantity starts reducing day by day, or if unexplained weight loss is happening, that can be one of the manifestations or presentations of stomach cancer. Colonic cancer, bleeding from the rectum. That means if any time bleeding from the rectum is happening, that is considered as an alarm sign. Always get yourself checked up. Better to do a colonoscopy or a checkup done, where even an early stage thing can be picked up and can be treated without surgery.
So, colon cancer has become one of the leading causes of cancer deaths in the US, and that is because of meat consumption.
Yes.
Now you are seeing the trend increase in India. Would you recommend then switching
We have to increase our intake of vegetarian, plant-based diet, fruit-based diet, lot of fruits, lot of vegetables, lot of fiber. I am not saying that you should stop non-vegetarian, but non-vegetarian, along with that there should be sufficient amount of vegetables which we have to enter. Then of course, we have got cancers of the pancreas, cancers of the liver, cancers of the gallbladder, which can happen. Fortunately, small intestine, very rarely you find cancers. And small intestine is 21 feet long, but that does not lead to cancers in many times, but pancreatic cancer can be seen. And pancreatic cancer, there is no known specific factor which can lead to pancreatic cancer, but somehow they have found an association between alcohol and smoking, tobacco and smoking combination as a important cause of pancreatic cancer.
So, for colonoscopies, there is recommendations in the US that by the age of 45 you should do a colonoscopy, and then for the next 10 years you don't need to do it. Is there any kind of recommendation in India for preventive testing when it comes to digestive diseases?
Actually, no, because number one is the population is too big, and doing any screening tests in our country becomes impractical. In US, this is followed because colonic polyposis is very common in America. And it so happened that in one of the TV anchors in USA many years back, she herself developed a colonic cancer which developed from a colonic polyp, and then it became viral, and the whole United States, everybody woke up, and then they started prescribing a colonoscopy everybody above the age of 40, mainly to detect colonic polyps. And then you remove the colonic polyp, then the chance of cancer development is gone. But in India somehow, because at least till now I think 60% of the Indian population is vegetarian. So therefore, we do not see colonic polyps so often, but which is on the increasing trend.
Okay. Well, the reason I ask is because, Indians generally don't have that kind of screening process.
Yes.
So would you recommend, because generally these kind of digestive diseases are found in late stages.
Yes.
So what can we probably do to pick it up a little earlier?
So I personally feel that if there is any family history of any cancers, or if the diet is a non-vegetarian predominantly, even though you are eating vegetarian, after the age of 40 or 50, might as well get a screening upper GI and colonoscopy done, just to check that your lining of the stomach, esophagus, colon, everything is normal.
And pancreatic?
Pancreatic cancer, one of the test to do, we can do some blood tests like tumor markers, which are not very specific, but you can do a simple sonography to even just get that checked. But there are no blood tests to know whether you definitely are likely to develop pancreatic cancers.
Okay. All right. Well, doctor, we need to take a short break, but we have a lot more questions lined up. We have a rapid fire as well. We take a short break and be back. Welcome back. Well, we're still in conversation with Dr. Amit Maydeo talking about digestive health and diseases. Well, we have a couple of rapid fire questions for you, doctor. So I'm going to start with the first one. Any screening for liver cancer?
Yes, sonography and a blood test for hepatitis B and C.
Okay. All right. What are Indians doing right or wrong when it comes to a diet?
Majority Indians are vegetarian, that's right. But many Indians are also eating a lot of fast food, not giving time to eat their food properly and taking a wrong diet. So that is something which is wrong.
Okay. Well, what is the healthiest type of diet you would propagate?
A properly balanced diet which is containing predominantly millets instead of wheat, then preferably avoiding milk, but taking altered milk products like curds and buttermilk, and making sure that you eat sufficient amount of fruits in between your meals, not during the meal or immediately after the meal, and 70% of your diet should contain good leafy green vegetables.
Okay. All right. Is IBD, which is irritable bowel syndrome, linked to lifestyle or genetics?
It can be linked to genetics, but it's predominantly immune system related. So these are because of environmental toxins, and it's because of the changing environment which we are going through, and that is the reason we are seeing more and more IBD on the rise.
So what are prebiotics and probiotics?
So prebiotics are good type of food which will enhance the growth of good bacteria, the good commensals. And probiotics are actually good bacteria in a liquid or a capsule format which we ingest to increase their population.
So does it help taking probiotics every day? What do you recommend?
Yes, there is no harm in taking probiotics. They will not cause any harm, but that will maintain a good milieu, a good atmosphere of bacteria in the gut.
So can you get enough probiotics from food, or do you need to take supplements when it comes to probiotics?
A properly balanced diet will give sufficient amount of probiotics, so you don't need to take probiotic supplements. Very simple thing like even simple pure ghee, that contains a tremendous number of probiotics.
What are the foods that help tackle acidity, a problem that you commonly see amongst your patients?
So tackling acidity is foods like cucumber, like tomatoes, or like avocado, or like melons. Such type of foods are definitely, they tackle acidity because they neutralize the acid. In fact, most of the fruits that we eat except the citrus fruits are alkaline in nature. So if you eat fruits in between, then definitely your acidity can be tackled, and not to fill your tummy too much. Always fill lesser than your capacity.
Okay. And is the overuse of spice linked to gut diseases?
Not exactly, because spice directly doesn't cause any damage to the gut. Unless the gut is already inflamed and you eat spices, then you have trouble.
Okay. Linkage of overuse of antacids or antacids to cancer?
No direct linkage. Antacids in a syrup format has got absolutely no side effects, but acid reducing medications can sometimes lead to problems like osteoporosis. It can lead to some vitamin deficiencies, and rarely, theoretically, it is supposed to link to cancer, but there is no proved data on that.
Okay. All right, doctor, we're going to leave it on that note. It's been a pleasure. Thank you very much for joining in and speaking to CNBC TV 18 on digestive health. Thanks very much, and thank you for watching.